Some Missouri health clinics are concerned after U.S. lawmakers questioned their funding sources. Senator Josh Hawley has called for cutting off federal money for a nonprofit in the state that provides free reproductive health care. More from Hannah Falcon.
STI tests, condoms, emergency contraceptives. These are some of the things provided for free to Missourians by Beacon Reproductive Health Network.
Missouri has a lot of uninsured and underinsured people, and access to this safety net program ensures that anyone, no matter their insurance, their zip code, where they live, that they can access this care.
Michelle Trupiano explains the state's only Title X recipient works with a network of 65 clinics across the state to provide reproductive health care. But those funds are constantly at risk.
When can you tell me, when are we going to stop funding people like this? I don't think that this kind of entity ought to be getting federal tax money.
Senator Josh Hawley questioned U.S. Health Secretary Robert F. Kennedy Jr. about why Beacon was receiving any funding, accusing them of illegally using federal money for abortions and gender transition care for minors.
They do more than just refer for abortions. They also proclaim their support for all bodies. They provide gender-affirming care, including to young people, that's gender transition surgeries.
Senator Hawley has his facts wrong, first of all.
Trupiano refutes these claims, saying Beacon follows the letter of the law preventing federal funds from being used for abortions, including setting up appointments or transporting patients. And state law bans gender-affirming care for minors. If Beacon were to lose these federal funds, rural clinics may close their doors.
This is not a political issue.
I asked Senator Hawley if he would reconsider his stance on Beacon's funding after they clarified their use of the money. He did not respond to my questions. Reporting in Jefferson City, I'm Hannah Falcon.